Alright, good morning, Miss Granger. I'm so glad that you're going to get to go home today. So during your stay here, we discovered that you have something called Clostridium difficile, otherwise known as C. diff. So C. diff is kind of super infection, which means it's an infection that occurs when you're undergoing treatment for another infection. This kind of bacteria will grow once the normal bacteria that's in your stomach is killed, and it allows for the C. diff to grow without any competition from those bacteria. So because of how dangerous this bacteria is, we will need to place you under contact precautions, which basically means that everyone that enters your room will need to have a gown and gloves so that we don't spread the bacteria throughout the hospital or get any of your family members infected too. So if you have any family visiting, make sure that you tell them to gown and glove before seeing you. If we don't see them, and tell them before they enter your room. They'll be located right outside the door. So also be sure to tell them to use soap and water to clear the bacteria out of their hands, because regular hand sanitizers don't work on it. I know you're probably curious as to why you got this condition, so unfortunately we don't usually know the exact reason, but since you had to take antibiotics earlier this month for another infection, this puts you at higher risk for getting the bacteria. So you've been prescribed something called vancomycin, so it'll help destroy the bacterium by destroying the walls of the bacterial cells that lead to it dying. So this type of medication has some side effects that we do want you to watch out for while you are taking it, especially for the first few weeks that you're taking it. So just to clarify, you don't have any kidney issues, right? Okay, good. Just want to double check because this type of medicine works in the kidneys, so we don't want you to have any kind of kidney issues before we give it to you. And then you also don't take any other antibiotics at home. Okay, good. Because this type of medicine, as I said before, works in the kidneys, so it can lead to a reaction when it is combined with other type of antibiotics that work there too. So the first thing that we want you to watch out for is something called ototoxicity, which is basically just like hearing issues. So if you have any hearing issues, call us. Another thing is bleeding problems. It causes thrombocytopenia, which is low platelets. That's all it is. And platelets are something that clots your blood, so when you have low of them, it's going to lead to more bleeding issues. So, and then the last thing we need you to watch out for is something called red man syndrome, which is basically a reaction where you kind of turn all red from taking this medication. So just watch for any redness, rashes, itching, or hives, and also try to monitor your blood pressure and your heart rate. So you'll see kind of like a low blood pressure and a high heart rate. So if you kind of notice that your heart is like really going, just make sure you watch out for those. You can call us. If you have any problems with any of these symptoms, just call us and we can change the way you're taking it or try to come up with something else for you to take. We'll have you come back in a few weeks to monitor your medicine levels in your kidneys and see how well the medication is working. So I know that was a lot of information at one time, but can you tell me what you're going to do when you get home? All right, thanks.